Good afternoon, it's Mayor Turner. I just wanted to update you on a few things going on. Couple of things I want to talk about first. There are rumors, and I've seen some of it in some of the national news, talking about COVID parties. And a lot of these people have talked about it's mainly college kids, and somebody with COVID goes in there, and then everybody else gathers around, hoping to catch COVID to go ahead and get it over with. That's not a good idea. There was a report that a young man passed away from a COVID party. I saw it in the news, but I never thought I'd have to talk about COVID parties. COVID parties are a horrible idea, just because not everybody knows how they're going to react to COVID. So I just wanted to say that and get it done up front. Also, a little bit, I understand everybody loving to debate about issues, especially Dr. Bartlett's what he calls a cure, what some people call, it doesn't work. When we do that, let's make sure that we're not aiming it at the healthcare workers. Right now, those people are on the front line. And to be a healthcare worker, a lot like I say about our fire and our police, it's a calling. People want to be in that field, and they are being just run to death because when they have 20 people out at medical center and you have, say, maybe 13 out at ORMC, that's just less people they can work. And those people are just getting, I don't want them looking at Facebook and seeing somebody griping about maybe whether that's a cure or not. It is totally up to you to talk about it. But let's make sure we're encouraging all of those that are working in the front lines, because like they said today on the press conference that I forwarded on my Facebook, we don't know if we're going to be one of those people laying down looking up at one of these healthcare workers. They are doing God's work. Everything they're doing because they love to take care of people. The ICU people are having to wear full PPE. It's hot, it's uncomfortable, but they're doing it because they love it. So I just wanted to get that out there. Now we'll get to the numbers. Talk about Amarillo. They're at 4,214 cases. Lubbock is at 3,932. Abilene has gone up to 1,373. San Angelo has gone up quite a bit. Now they're at 1,065. Midland is up to 1,266. And our new numbers, just got these numbers. Total cases of COVID in Ector County is 2,175. Right now we have 1,264 cases that are active, because we have had people that have gotten better, which is 911 have recovered. We have had 22 deaths, and that's where we are today. The number is slowing. I don't want everybody to take that for granted. We need to continue doing what we're doing, because right now we are waiting for the 14 days after July 4th. A lot of people feel like there may be a bump after July 4th because a lot of people got together, a lot of people went to the lake, a lot of people got with family and things like that, and we just want to make sure we don't have a bump there. Because like I've told you many, many times, we are in control of what's going to happen at our schools. If the COVID numbers are running up, it's really going to make it hard for the schools to say, we think it's in the best for all the kids to show back up when the numbers are going up. If the numbers are leveling off, we're always going to have COVID cases, but we just want to make sure that the school feels comfortable to open back up, because many of these kids, I understand digital learning is fantastic. A lot of people use it, but especially kids need the social interaction, and they learn a lot by going to school. You learn, how to deal with other people, and things like that. And that's really the big concern. And there's a little bit of talk of an education gap, because it's really hard to have a kid's attention. It's hard to get a kid's attention when they're sitting in front of you. It's even harder when they're on a computer screen. So give you an update on that. Talk a little bit about the hospitals. Right now, Medical Center has 43 in the hospital. They have 9 on ventilators. They have 6 on the Medical Center campus, and they have 3 at what they call their overflow, which is the Wheatley Pavilion, which is just basically right across the street. They have 432 tests pending. ORMC has 15 cases in-house. They have 8 on ventilators. And they have 47 tests that are pending. Talk a little bit about the test. The city has used our COVID money that we got from the federal government to have the free test. Those tests are going very quickly. We will have another one tomorrow at UTBB. The parking lot will open at 7, and they take the first 200 cars. Please do not get out of your car. These are in-car only tests, so we can social distance everybody and make sure we have the distance. So make sure you get there a little bit early. If there are going to be more, please check the Facebook on the city page, and there are plenty of things there to tell you when it's going to happen and everything you need to do. So they ask that you make sure your windows are rolled up, and when you see a person come up in PPEs, they're the ones that are going to be talking to you, getting your information, and get everything set up for a test. So tomorrow they will have 200 tests. That's all the lab allows us to have, so that's why we just have 200. But we're still going to have 4 more free testing centers or testing sites. So hopefully we can get everybody tested that needs to. We have had, Singular Care has been doing a lot of tests. We have had, CVS has opened up to testing. It is only the CVS that is over on 42nd. I believe it's right there by the mall. It's right there on the corner. They are doing testing. From my understanding, you have to call first. They don't want you going in the store with COVID. And they will come out and take care of that. But that's another site. That is a longer test. That is one of the tests that they send off. But they have been getting the test back quicker than we've been seeing here in the last couple of weeks. I want to talk a little bit about the ages of the people that have passed away. Eddie Shelton has done a fantastic job updating the county numbers. And so I want to give you this. It was some information he gave today that I thought was really good. From 90 above, we have had 3 people pass away. From 80 to 89, we've had 2 people pass away. 70 to 79, we've had 6 people pass away. 60 to 69, we've had 6 people pass away. From 50 to 59, we've had 2 people pass away. 40 to 49, we've had 1 person pass away. And from 30 to 39, we've had 2 people to pass away. So that kind of gives you an idea. They're pretty spread out. But from the information, we have not had anybody under 30 that has passed away, which is fantastic news. Let me give you the updates on what's going on with the nursing homes. Focus Care has 8 patients that are positive. Sienna has 22 that are positive. Parks has 0. The Clover House actually has 1. Buena Vista has 3. Deering has 1. Courtyard has 5. So those are the cases. There's 46 cases of COVID in the nursing homes now, but they've really been doing a good job of holding them back. Many people have asked, well, are all these patients in the hospitals from Odessa or Ector County? No, they're actually not. We are having people brought in from the surrounding smaller counties, and we have 4 from Andrews County, and we have 2 from Pecos County. Talk a little bit about, a lot of people have asked about that show. I think it's a paranormal show is what they're talking about going on at the Coliseum. The city cannot actually control the Coliseum because it's Ector County Coliseum in the name. But according to my conversation with the judge, she said that the Commissioner Court has approved it, and they are taking cautions or the appropriate actions to make sure everyone is safe. So that's the information on that. Right now, we still don't have anything on the schools because honestly, it's still a little bit early. I know they're working on a multitude of plans. Really, honestly, it depends upon each one of us. If we can slow the curve and bring the numbers that we're seeing, positive cases, slow it down, it's going to make it more apt that they will be willing to open up the schools. Colleges, I still haven't heard much. I'm going to try to get that information for you on Monday, and at least kind of tell you which way they're leaning or which way they're not. So that's the report for today. If you see a health worker, you know somebody, please send them a text, say thank you for everything you're doing. Continue the great work. God bless each and every one of you. God bless Odessa. God bless Texas. And God bless the USA. Please stay safe. Thank you.